everyone, welcome to Nora's TCM. Welcome to today's case learning, Sjogren syndrome. Part 1. Let's have a look at the basic information of the patient. It's a 49-year-old male. His chief complaint is dry eyes and mouth. The complete symptoms, no obvious symptoms. Past medical history, chronic prostatitis. Red tone with a thin white coating. Very thin pulse. Part 2. 3 phases of the Sjogren syndrome in TCM. Before we discuss the case, we have to know the very basic 3 phases of a Sjogren syndrome in TCM pathogenesis. It is classified into early phase, middle phase, or we call it developing phase, and late phase. In early phase, there's obvious yin deficiency or body fluid deficiency. In middle phase, or we say developing phase, there's a qi and a yin deficiency. So it's a combination of the qi and yin both, and sometimes complete with joint systemic symptoms. And finally, it's a late phase. It's a qi and yin deficiency with the blood stagnation or organ damage. So generally speaking, in the early phase, it mainly manifests dryness. In the middle or say developing phases, it is manifests the dryness and also with the qi yin deficiency. And in late phase, it is not only qi and yin deficiency, but with the organ damage. So that means 脏腑 organ dysfunction. Part 3. Pathogenesis of TCM in Sjogren syndrome. Let's have a look at the general pathogenesis of the Sjogren syndrome. We have mentioned qi and yin deficiency is the most basic pathogenesis to generate the dryness of a Sjogren syndrome. But we have to know which organs qi and yin suffers most. So this is very important point because we have to finally select the points, we have to select the meridian, we have to select herbs. So herbs is not a general concept. We have to know which 脏腑 organ so we can know which meridian or which herb enters into which meridian plays its function to nourish yin. So to Sjogren syndrome, it's a qi and yin deficiency in lung and stomach, and also combined with the liver kidney yin deficiency. But the main part is the qi and yin deficiency in lung and stomach to form the dryness. And also we have to say liver kidney yin deficiency is another aspect, but maybe it's not comes very obvious in early stage, or we say early phase, developing phase. It is gradually comes out its function in the developing process. So in early phase, maybe only lung stomach yin deficiency, dry mouth, thirsty, but with the development of the disease, liver kidney generates the yin in the root. So if there's a liver kidney yin deficiency, for example, in a moderate age, it damages more. It will make the qi and yin deficiency in lung and stomach worse. So generally speaking, qi and yin deficiency in lung and stomach to form the dryness is the main part in the formation of the pathogenesis of a Sjogren syndrome. But the liver kidney yin deficiency will gradually anticipate into the formation of the pathogenesis in the developing process of the disease. But don't forget one organ. We have to mention spleen. We know spleen will generate and produce qi and blood to support the body continuously. So we call it spleen is the generator to qi, blood, yin such material. So in each of the formula, we pay more attention in qi and yin in lung stomach, but we still have to come back to the source of the generation. We are strengthened in a tonified spleen, in balance in whole prescription. Next part, analysis of the formula and doctor's treating idea. Generally speaking, There are some special herbs for some symptoms in Sjogren syndrome we usually use. First, eye symptom, we will select 古今草, 菊花, 生地黄, or we used formula 增液汤 modified in other formulas. Herbs for dry mouth, we normally use 石斛. Herbs for joint symptom in Sjogren syndrome, we normally use 桂枝, 白芍, or herbs with the Chinese character 藤 such as 鸡血藤. And we have to say, and herbs for joint system, this is a complete systemic damage in the developing of the disease. And the tong is a kind of a series of herbs got very strong function to judge meridian. Judge, it means activating blood in the channel. We say activating blood, it means activating local more. But if we wanted to judge meridian, that is to say, blood stagnation in the channel, we want to promote the qi blood circulation, remove the stasis in the whole channel, we'll say judge. So this kind of herb like 鸡血藤, 海风藤, so all these herbs with the character of the tong, it's a series of a plant got to function to judge meridian, promote the qi moving faster in the channel. Herbs for blood stagnation. We have mentioned in the pathogenesis, in the formation of the disease, with the developing of the disease, it will combine with the blood stagnation, especially in the late final phase. But here we have to mention, some of the herb applied here cannot generate the function of generating blood. So when doctor explain you, and herb are used for generate blood or produce blood, most of the time it's indirect way. So comparing with the inner organ tonifying or generate blood and nourish blood, in the joints problem, or we say in the systemic immune system disease, especially for blood stagnation to joints or organ, and we have to say there are a lot of different methods to produce blood. First method is very indirect. It is very direct. First method is very direct. Some method is very direct, like 熟地黄, 阿胶. They place the function of tonifying nourishing the blood directly. They got very direct function to produce blood, but like the 当归, like the 鸡血藤, they also place the function in generating blood, but it's an indirect way. It will promote blood circulation to remove the old blood stasis to help the new blood generation, so it's an indirect way. So in clinical treatment, we're not only tonify blood by direct way, but activating, remove the old to help the new generation. It's a very important method as well. Another problem we have to discuss in the treating of the Sjogren syndrome is the blood testing index. We know the Sjogren syndrome is an immune system disease, so patients will seem to do a lot of blood testing to make sure the diagnosis and also observe the development of the disease. One of the blood testing for immune active factor, that is C-reflecting protein. In TCM pathogenesis, we believe C-reflecting protein, the index, is put into heat toxin, blood stasis, or blood heat. This is combined with the feature of a Sjogren syndrome, dry mouth, dry eyes, and with the yin deficiency. So we think the hyperactivity of the immune factor C-reflecting protein is pertaining to heat toxin, blood stasis, and blood heat. So we have a corresponding herbs to cope with the situation, such as 黄芩, 金银花, applied to heat toxin. 虎杖, it's applied to blood stasis. 生地黄, it's used to cope with the blood heat. Let's take a look at the formula of the case. Most are nourish yin and also some herbs, especially for eye, especially for mouth, also strengthen spleen and promote the qi moving, tonify qi. So the formula includes 20 herbs of yin deficiency, cooling blood and clear heat, and also promote digestion, and also moistening large intestine. So maybe patient combined with some accompanying symptoms. It's not recorded in the records we can see in the paper. Some accompanying symptoms will be treated with moistening large intestine. So this is the whole formula. Let's take a look at the proportion of the each formula in the function. We can take a look at tonify yin, nourish yin occupied nearly 40%, and clearing heat to treating and cope with the dryness occupied 22.7%, and also regulate qi, promote digestion, and support with 26.7%. So these are three main parts in the doctor's idea to cope with the disease: nourish yin, regulate qi, and resolve the dryness. And also with some accompanying symptoms like moistening large intestine, maybe patient complain with the constipation, so that is why doctor use one herb to cope with the situation. And also the patient blood stagnation is not so serious. We have mentioned in pathogenesis, blood stagnation is commonly happened in the late phase. So maybe this patient not so serious, not in that phase, so blood activating herbs is not used a lot. Okay, this is the case of a Sjogren syndrome. So, quick recap. First, the pathogenesis of Sjogren syndrome is by qi and yin deficiency to form the dryness. And second, the main etiology and pathogenesis in the disease that is yin deficiency, blood heat, blood stagnation, and also dryness. And finally, the treatment principle is to tonify qi, nourish yin, clearing the heat, cooling the blood, activating blood to regulate qi moving, and accompanying with other treating principle following symptoms. Thanks, patient, to provide information for us, and also thanks to Jiangsu Provincial TCM Hospital. I'm Dr. Nora. See you next time. Bye.